Now to Parliament, a livid member of the Public Accounts Committee is expressing his disappointment at the absence of the Health Minister, Kweku Agyeman, and two of his deputies at the committee sitting today. Drama unfolded when the Director of Policy Planning, Monitoring and Evaluation told the committee she is sitting in for the Chief Director and the ministers who are yet to return from their constituencies after the NPP's voting exercise. We'll get to hear how the matter was subsequently resolved, but first, listen to the Director, Emma Ofori Agyeman. Unfortunately, we are unable to bring you that just yet, but let's go live to Parliament now and speak to our correspondent, James Aveji. James, the committee wasn't happy with this information. How did they react?
Yes, Mabiesi. So, when the Deputy Director in charge of Policy Planning, Monitoring and Evaluation introduced herself to the committee, she indicated that she would be standing on behalf of the Chief Director of the Ministry of Health, as well as the Minister, Kweku Agyeman, as well as his two deputies. Her explanation was that the minister is yet to return from the constituency after Saturday's primaries, NPP parliamentary primaries, and that includes the two deputy ministers who also contested in their various constituencies. Now, a member of parliament for Bole Bamboy, Honorable Sulemana, on the instance, or on the spot, retorted to the explanation. He asked permission from the chairman and expressed his disappointment and anger at that information. According to him, there are members on the committee, sitting on the committee today, who have also contested in the election that came off on Saturday. And so he did not understand why the minister, the two deputies, as well as the chief director of the ministry should be absent at the sitting. He requested that their presence, they come to the committee before the committee hears them. And so he wasn't too happy at all. Another incident unfolded where the burns and plastic surgeon department of the Kolebu Teaching Hospital was called to come to the committee, but no leadership of the department was nowhere to be found. And so the health ministry, the director of the Ghana Health Service, had to step in for them as well.
But really, how was this issue resolved? Was there anything said to that effect, especially with the health minister and his two deputies?
Well, the committee chair, Honorable James Kuluchi Aveji, had to step in. And on a lighter note, he made fun of the fact that the two deputy ministers have lost their respective elections. And so maybe they are grieving from that and unable to appear to the committee. And so he actually gave the go-ahead that they can proceed since the Director Policy Planning and Evaluation is around, and the Director General of the Ghana Health Service is also around. And so that intervention was accepted by other members of the committee, and then they proceeded with the sitting.
But who else is on the committee now? What more do we know?
Yeah, so the health ministry is still there. They're looking at the Auditor General's report on various government hospitals, from teaching hospitals to regional hospitals and some district hospitals who had some infractions in their audit. Key issues that have been coming up are about unserviced bonds, where various hospitals gave a study leave to their workers who have gone outside to study, or even within the country who have migrated out of the country. You remember the outflow of health personnel, especially nurses. Most of these nurses, according to the report, have been given either study leave or have been given some funds to go and study and return, but most of them, when they go, are not able to return. The instance of two key ones from the Pantine General Hospital, as well as the Sege Hospital, the response from the ministry or the Ghana Health Service is that they are liaising with Interpol as well as IOCO to retrieve some of the money. And so most of the infractions, I would say, have been corrected by the ministry. Auditors have also confirmed the retrieval of such monies. The few ones that are yet to be collected, they indicated that they are actually working with Interpol as well as IOCO to retrieve the money from those health service personnel who have migrated out of the country but owing the institutions they work with.
Thank you very much. James Avaji is our man at the Public Accounts Committee hearing.